We are live. Hello and welcome. I am Kerry Mussington, the founder of the MOM Project, also known as Mind Over Matter Suicide Prevention. And I have Mick Snelders here. Mick Snelders is going to tell us an incredible journey of where he is, how he got here, and where he is to this day. I'm just delaying a little bit so somebody can come in at the same time. I don't want them to miss the message, Mick, because it's beautiful. So I've got, before we even start, I have your video ready as well. And I thought it'd be potent to share a little bit of that video.
Yeah, fine.
And then I'm going to ask you lots of questions, lots of questions. So what brings you to here then? How did you connect with Mind Over Matter?
It was actually, so there's some connections with a cousin of mine put me in contact with you because I think she's on your page, Nikki, and also Louise works with my partner, and it's just all these little things came in together, and then I've got told about Mind Over Matter and said, look, what you're doing, what you're pushing for, and then saying that you wanted to look at men's issues as well, because there hadn't really been much about that. And so that was the initial thing that got me in contact with you, and it's been quite exciting ever since, really. So yeah, no, really happy about it.
You got my full undivided attention now. I just had to share out to all the people, because this is what we're about, isn't it? We want to get out this message, what you're going to bring today. We want to push this out as far as possible. And we know that the MOM Project has these wings and it's flying worldwide at the moment. So that's good. But if each person that listens to Mick's journey about how to cope with cancer, if you was to share, you could prevent fatalities within your neighborhood or within your community, even within yourself, if you can get the right details embedded in this brain of yours into getting checked, or to project that message out to your loved ones. Because if you don't project that message out to your loved ones, oh my God, it doesn't just stop with, as Mick was living with cancer, right? Living with that horrible name and trying to push that out of your system. Correct? That's where we are. And if you don't push out this message that this man is dedicated to giving you personal details, then I have to say to myself, what are you doing with this world? Because we can't do this alone. We cannot save the whole world alone, but the messages that we project out is important. And what you can do is your part and share the message. So I'm going to see if I can work technology here.
Right.
And share your video.
Okay.
Can you see that?
It's starting. Oh, it's coming up there now. Yeah.
You can see that. So I'm going to mute our mics, please. And I'm going to share your video. Okay.
was an unwanted guest.
We have a bit of a technical issue here.
I imagined Crips after my...
So can you hear me?
Yeah.
I apologise that I can't hear. I could hear at my end.
All right.
You couldn't hear at your end.
Well, I don't know if there's anybody else who's on. If somebody else can let you know if they can hear it. I don't know who's online. If there's someone there.
Here we go. Let's have a look. No, that's yours. I put it on your end, and I tried it on my internet to see if I could hear the message, and I couldn't hear the message. Could anybody else hear that? Could you comment if you could hear the video, please? I have no idea what happened there. I'm going to try it again because I think it's a really important message. And tell me if you can hear it. So I just won't talk. All right. So try that again. Okay. This is technical. This is real life. This is reality. You know, we're not scripted here, and we're just human beings trying to make a difference within the community. So, you know, here we go. Can you see that now? Yes? Okay. Can you hear?
So, it's a holiday of a lifetime. A month in Australia, beginning with 3 nights in Dubai, then to Melbourne for friends and family, Brisbane for a wedding vow renewal, Sydney and Adelaide for shark diving before 2 nights in Singapore and home. No, this isn't the prize for getting through cancer. This was the holiday that got scuppered 5 days before we left due to cancer. Now, I know many people are uneasy with the word cancer. From past history, it is the brother of the Grim Reaper with no escape. The reaction to the word contorts the receiver's face in a variety of ways, whilst attempting not to alarm you. So, in order to take the weight off this, I would call it Carmen instead. Carmen, after all, is a much smoother sounding word. Carmen is a seductress that gets hold of you in a gentle first engagement until you realise the extent of her grip. It's also a good distraction method to ease the listener in when you say, I have Carmen. Then, oh, sorry, it's what I've chosen to call cancer. People would be more mesmerised and tend to be confused. On several occasions, the first questions could be about, why Carmen? Rather than the type or severity of the original word of doom. In fact, it would be a wonderful code word for those close enough to be informed at the early stages. You'd be asked how Carmen was today, and those outside the ring of Carmen consciousness would be baffled, and you could tell them that Carmen was an unwanted guest who we hoped would be leaving soon. I imagined quips after a month of joining in asking of Carmen's presence that it sounds like Carmen needs to be surgically removed. Well, how very astute, without even knowing. I have to say, I am incredibly lucky. Always have been. And the main reason for that is because I rarely take myself too seriously. So when I was told the results were nearly 100% positive, as it was in 11 of the 12 sections of my prostate biopsy, I corrected the consultant that it was 92%, so not as bad as he was making out. As we left the room, my girlfriend was in more shock than me. Her eyes had widened and indicated there was only white noise rattling round her head. She thought we would go in, they would say it's not Carmen, and I should go and enjoy my holiday and life. In fact, she asked if I was okay to drive, which I was. If I remember rightly, my legs hadn't fallen off, so yeah, fine. She seemed mortified in the very casual way the consultant had, in such a blasé manner, said, have you had the result of your biopsy? There is a Carmen there. This while he had his back to me, whilst rummaging through a file. We asked him to repeat it, which he did as a matter of factly as the first time. I told her it was obviously a daily event for them. And what would she suggest? I mean, I thought maybe a guy in the corner at a small electric piano that when you were told would take his cue and play da-da-da, or the EastEnders end credit music. The drive home was more normal than the drive there. On the way had been the element of uncertainty, knowing there would be a revelation and then planning how to deal with whatever arose. Well, now we knew. Not what would be the next steps, but with what we had to be dealing with. Better call the travel company when we get back. Oh, and ring the family. And then after a pause, the breadth of the Grand Canyon. I fancy some lamb tonight.
I'm really sorry about the.
It's all right. You've gone on to the second video there. It's not showing, but you can just need to stop there. That's fine, Kerry.
Yeah.
The main thing is I did have lamb that night, so don't worry.
Yeah, there is a link that I've put with this video, so you can please go on to Mick's YouTube channel and look at the way that he has presented stage by stage. But here we're going to give you a snippet of those stages. So thank you, viewers, for bearing with us with this technical issue. But here we go. We have the man himself, so he's going to tell us from his mouth. So what alerted you to needing to be checked?
Right. Well, first of all, before we go on to that, I just need to make sure people realise I'm not a medical practitioner. Okay, I'm not a doctor. I'm not an expert. I'm somebody who's gone through it, and I have a little bit of knowledge of different things. So if there are specific things people want to ask that I can't answer, I think you've got the thing for Prostate Cancer UK, and they've got some specialist nurses, and they are brilliant. I've spoken to them on a few occasions. They're excellent. So if you do have a real concern and it's not something I can cover, phone them. So again, it'll ease your mind from there. So what alerted me? I was one of the people who didn't have any symptoms whatsoever. Again, some of the people who will have watched our last chat will hear a couple of things again, but it's important for everyone that knows with this journey that I had no idea about prostate cancer. I didn't even know I had a prostate actually before about 2013, and that's when my instructor and colleague and friend found that he had prostate cancer, and we saw him through his journey. And unfortunately for him, it was caught too late. But I had no symptoms. And then I'd heard the message that, well, if you're over 50, that's the time when you should get checked. So I thought, well, maybe I should get checked. I don't feel anything. There's nothing wrong. So there was nothing that actually alerted me other than the fact that I'd known somebody who'd suffered through it. I was of the age group, and I went along and got checked. And that's when I found out I had it. So that's nothing at all to alert me.
Wow. Did you know much about prostate cancer, as you just said you didn't?
No, I mean, it was something that beforehand hadn't even entered my head. I think we're all of that thing that we know a little bit about our bodies, but we don't know the intricacies of every little organ and thing that goes on in there. And until something goes wrong with it, and we go to the doctor and say, it's your blah, blah, and they give it some great big long sort of Latin name, so we don't pay attention to it. It doesn't come to the forefront. So I had no idea about prostate cancer before this.
So there really wasn't much awareness going on within the community. No one was really talking about it. Wow, that's interesting, isn't it? So how did you react to the initial PSA numbers, and who did you reach out to?
Well, again, it was weird because you're told that the numbers should be between 1 and 4 for a normal reading, and 4 is at the high end. And my initial reading was 22. And what happened was I'd gone to the doctors and I'd asked for a PSA check, and they didn't actually do it on that time. And when I phoned up and said, I want the results, they said, we didn't do that check. So I went in on the Friday and they did the check again, and they said, look, we'll give us a call on Wednesday. And if you give us a call on Wednesday, we'll let you know. And if there's anything before that, we'll give you a call. I thought, fine. And then on Monday, I had 3 missed phone calls. And then when I eventually spoke to the doctor, he said, look, your PSA is quite high. He said it could be a number of things. He said it could be this, it could be that you've got a problem with the prostate, it could be that you've got an infection. He said, but with those numbers, I am quite concerned that it could be prostate cancer. And I just went, okay. And I'm quite pragmatic about things and quite practical. Okay, so we don't know, but we're leaning towards that. And I didn't phone anyone at that point. And Lisa, my partner, came home from work, and unfortunately she works during the daytime, and I teach taekwondo a couple of evenings a week. So when she came home from work, I cooked the dinner, I put it in front. I said, oh, by the way, the doctor's called, they've given me the results and they think it might be prostate cancer. I've got to go to work now. And I left her with that. Wow. It wasn't till later on in the week that she said, that was not a nice thing. I said, but I was just, what am I supposed to do? You just carry on until you know something else. So she was the first person that I told. And I think it was on the Saturday, there was a taekwondo competition. And I started getting a bit jittery before that. And I phoned up my head office and said, look, my headspace at the moment is full of this. And if I'm going to be, I have to be used as an umpire, etc. Put me in a corner somewhere where it's not at the forefront of what's happening, because and they were very good about it. And while I was there's another friend of mine, Sammy, and she came along and I chatted to her. So there were a couple of people that I just put little bits out to, because you don't want to say it and then it turns out to be nothing. So, I might have a little worry about it. If I tell lots of people and they all worry, and then there's nothing to worry about, I've caused that worry. So I only let it out to a few people at that point.
So it's interesting that you said that you just slipped that in with your wife and then you went off to work. I wonder what emotions, if that was, I could feel a bit of emotion when you said it, and that it must be is it easy for you to go and have that distraction? What was her distraction now? Do you know what that was? I mean, how did you cope in your way? But let's have a listen to how you think she coped with that.
Yeah, she's very strong, and sometimes it's difficult. Later on I'll tell you, sort of like when I heard about certain reactions of her, but with me, she's all, we've sat down, said about things, so okay. And really, I think she stayed strong for me. And I didn't really see much about what she went through until I heard things from her sisters, her family, who she saw, and then she let it out to them. Mm-hmm. So yes, she wasn't particularly happy with me that I said, I might have cancer and I'll see you in 3 hours. But she was like, okay. And then sort of, because for both of us, it was a bit of a shock. And I didn't handle it the best way for her. I think that's the thing, is that, like we say, what you do is you do what's best for you. You try and protect yourself and go, right, this is how I'm going to go forward, and you don't fully consider at that point how other people are going to react.
Yeah, you kind of, this is called disassociation in a sense, isn't it? You could just switch it off. I mean, I think, yeah, I get that one. I get that point. What I did pick up though during your conversation is that you received a phone call. It wasn't a face-to-face appointment, it was a phone call. Did they, during that phone call, ask you if you had anybody beside you whilst you took that phone call?
No.
See, can you see? I think that you think that could be improved. Do you think that's a way of dealing with people should receive that news like that?
It's quite weird, because I think all through it, I say it on one of the videos, all through it, the medical people were very precise. Boom, here's the information. They deal with it every day. They deal with hundreds of people in those situations, and they have to get information across. And they talk to you about it. I suppose there's also that thing of, like when you phone up for electricity, like if I phone up about my mum and say, I want to talk about her electricity bill, is she sitting there? Do you have her permission and stuff? So with other people, they're talking to you, and if it's other people, they might say, do they want to hear? Do they need someone? Do you need someone? But they want to get the information across, say, right, this is where we are at the moment, and they probably don't think about what a weight it might be to you, because, like I say, for me, it's like, okay, we've got the information, let's carry on with the day. And I know from later on that there are people that I've known about, and this is why I also started doing talks. There are people that I know of that just hearing that you might have cancer destroys them.
Yeah.
And then there was a man that was during radiotherapy that was saying that when he was told he had cancer, it just destroyed him, even though he had a very low grade and they could cure it. And a few months later, they said, you're cured. He couldn't take that as well, because he convinced himself that was it. So I always hear on the phone when they're talking, if it's on a phone call, they are treading on eggshells because they don't know how you're going to react. The first time I felt a medical practitioner had any kind of real concern, when I thought somebody might have a concern, was when I got phoned up by a doctor, and because I'd asked them, said, look, I might need a little bit of help here. And when the doctor phoned me back, and I said, look, I don't know if you know what my situation is. And he said, I do, Mr. Snelders. He said, I'm really sorry to hear that. And that was the first time somebody seemed to have a personal thing. Up to then, I was this person with this ailment, with this disease. So yes, they could be better, but they have to get information across, and they have to, they've got to be practical about it. And I think that's one of the things, is that they give the information and they're used to it. And I think also they know further down the line, if they look at your particular diagnosis, they might know that it's a low grade, that it's, that it's incredibly treatable. But you obviously don't know that at the time. All you know is that you've got this initial thing. So maybe they can handle it better. But I think that's also on a personal human level, is that you might have somebody, when I had to have an appointment last week, and the guy I saw then, really nice, really personal. And I thanked him, and he said, well, it's my job. And I said, yeah, but some people do their jobs better than others. And the way you handled it has made me feel safe, has made me feel good. Whereas other people, they might have the knowledge of doing the job, but they just put it out, and they've not got a particularly good way. So I think it's not that necessarily overall it has to be covered like that, but I think that it's the individual. Do you get somebody who's good personally, or do you not? And that's the luck of the draw. I think when we were talking to JD the other night, and he was saying about sort of going to the doctors and things, and he's thinking, well, is that due to your own particular doctor, or is it doctors in general? Sort of, you might have that if you have a doctor that's not very empathetic to your situation, it makes it harder to approach them.
Well, I think since your awareness, I know 2 males that have put themselves through getting the test.
Right.
So that's what I know of so far, and I think that's a good thing. Was it one test that proved that you had prostate cancer?
No, there's no one definitive test when they do it. So there's a kind of few levels they go through. So because the prostate problem and prostate cancer can show the same kind of symptoms, they will go through a few tests. So the first test they might do a urine test. And this will show that if you've got any infections, you might have a urinary tract infection. So again, for the people who don't know where the prostate is, so the prostate's a gland that helps produce semen, and it's underneath the bladder and around the urethra. So a lot of the times, if there's problems, it might be if you're struggling to go for a pee, or you're peeing too much, you're peeing more. So if there's a change in your sort of normal routine, that might show a prostate problem. So the first thing they might do is do a urine test to see if it's an infection, because it could be something like that. It could be something as simple as that. They will do what's called a PSA test. Now, PSA stands for prostate-specific antigen. which is showing the levels in the blood, which is between that 1 and 4. You can get that test if you can ask for that if you're over 50. But also, because in the Black and Afro-Caribbean community, you're twice as likely, instead of 1 in 8 men, it's 1 in 4 men who might contract this in their life. So what they do is they say, if you're 45 and above, you can ask for that if you're in that community. It will also have other factors about health-wise. If you are, in the family, if your brother or father has had it, you're 2.5 more times likely to get it yourself. And one fact that blew me away really was that if your mother or sister has had breast cancer under the age of 60, you're still more likely to get prostate cancer. So, you know, it's one of those things that you don't think of, that cancer in the family and the female side might link you to having a higher chance of getting prostate cancer. So looking at all these things, so they might do the urine test, they might do a blood test. If they think there's something happening, they might do what's called the DRE, digital rectal examination, where they put their finger where the sun don't shine, and feel to see if the surface is smooth, if it's rough, if it's enlarged, and they'll do those tests. And based on those, they may then send you further, which is biopsy, which is actually taking little parts of the prostate to see, and then it goes to get checked up, and they will find out if there's sort of cancer from there.
Did you feel the same with each test? And was your anxiety building up?
It's quite weird, because the first initial shock of being told you might have prostate cancer, and then you go, okay, I'm going to have these tests. So so I had the blood test is the first one where because I didn't do a urine test, all I did was went for the blood test. Because I was I was 51, I said, right, I want to have a PSA test. They went, fine, and they have to do it. It is your right, men, it is your right, if you're over 50, to ask for it. You should be given one. They cannot deny you that. That's one very important point. So after they'd said it was 22, my doctor said, I'm sending you straight for biopsy. And I went along with Lisa, and I thought it was a bit odd because the guy said, right, do you both want to come in? I thought, it's not something I think is, sort of like for, sort of viewings, lying there on my side, sort of having this done with my partner there. But he actually did the DRE then. He didn't do the biopsy straight away. And this is one of the things, DRE, the digital rectal examination, where they put the finger up the backside. So, and the thing was with that was my doctor had said, because your PSA is so high, you should go straight for biopsy. But then the consultant says, no, I'm the person who will tell you if you're going for biopsy, so I'm going to do this first. So it was a bit of a who can pee up the wall highest job, I think, on that. And at that thing, when he did the DRE, he actually said to me, your prostate doesn't feel too bad. He said, it feels fine. He said, why do, because what was going to happen was we had just planned a holiday of a lifetime. And Lisa and I were going to go to Australia, and we've been planning this for ages. And we were going to go to Melbourne, we were going to go to Sydney and Adelaide, we were going to go shark diving, or she was going to go shark diving. I was going to use a camera and have the health insurance whilst I watched her. And we got this all planned. And this was something like a week before I got diagnosed. So the doctor said, why don't you go on holiday, come back, and then we'll do another check. And I thought, well, we can't do it in 2 weeks' time because we're going on holiday in a week. And he said, oh, we'll do another one now. One of the frightening things was if I'd gone on that holiday, that might have been my last holiday. Because when they found out after that how aggressive it was, with each bit they went along, they found out how much more aggressive it was. If I'd gone on that holiday, that would possibly have been my last holiday. That's how quick it was moving. So they did another blood test there. And then they said, oh, it's jumped to 26.8 within a week. And then they said, we need to get on with this. So that was when things started going, right, okay, this is getting a bit more serious. I was lucky in that the people around me, I've got a very special uncle and aunt. And my uncle both of them have a wicked sense of humour. love them very dearly. And when I had to go, because you have to go for an MRI to see if it's in your bones, and when they're there, they say, they give you a suppository whilst you're at the hospital and say, right, use it, and they give it to you and say, go and do this in the loo, and then we'll do the MRI. And when I was having difficulty. When I say difficulty, it wasn't putting the thing in. It was in a plastic wrapper that was so tight I couldn't open the thing up. So I was quite a while in the bathroom, sort of trying to unwrap this thing. And my uncle was getting a bit concerned because I've been in there for a while. And he knocked on the door and he said, "Who goes there, friend or enema?" And so again, the sense of humour was keeping it light. So any build of anxieties, we managed to slice away. Like I say, we were slicing away with humour and finding the funny bits with it. And that's where I think I managed to keep a lid on the anxiety.
So can I just repeat that joke again? Because when I first heard that through your video, I did burst out laughing. Who goes there, friend or enema? I did. I laughed like anything. And I thought, go on, Mick. You know, your testimonial right there is to, you know, he wasn't dampening. It makes it lighter to accept what's happening, you know, listen to your story. On the day you were told, what did you do with that day, and what happened on the day you were
told? Because we'd done the first blood test, 22, second blood test, 26.8, and then we had to cancel the holiday, and so as you heard on the video there, we were told about it. But what happened was, when we went along, Lisa was convinced in her mind that it's going to be nothing. And I suppose because when you feel fit and healthy, and one of the lucky things for me, and again, I hope anybody watching this and anybody who's going through prostate cancer doesn't think I'm belittling it, because I saw my friend and I saw him go through an awful time, and he was taken from us. And I don't belittle it, and but it's trying to find a way to cope with it. So because I never actually had any symptoms, I didn't have any pain, I didn't have anything that told me, other than a doctor telling me, you've got prostate cancer. What, where? I feel no different. So I was convinced, and Lisa was convinced, that when we went into that office, that they were going to say, no, we're wrong, it's not that, it's just something else, and we'll give you some medication, you go. And then we could go, we'd do the holiday, and everything would be fine. And so there was a little anxiety going in there. And like I say, it dawned on me in the waiting room how many people, and it wasn't just prostate cancer, but there were lots of people in that oncology department waiting. They'd gone in there and they were going to go into a room and be told, no, you're fine, or yes, and we've got to do something about it, or yes, and it's easy, yes, it's bad. You know, there are a lot, but that room was full, and there was another room that was also full. And it just made me realise, and again, as we were saying before about the doctors talking about it, to say, you know, sort of what they're like. Well, they were, every 20 minutes or so, they've got people going in and out, and they're telling them news. So for them to be really personal and stuff and that, it's, you know, they've got a job to do. It's quite weird. So when we went in, a little apprehensive, and then we were looking and we're sitting down, and I think it was when he said, yes, you've got a cancer. And the way he said it was just off the top. And I said on the last talk that he was actually like this, looking at his computer screen, and said, have you heard of the result of your biopsy? And I said, no. He said, oh, yes, there is a cancer there. And it was literally like this. And and Lisa asked him, she said, can you say that again? And he turned around and said, there is a cancer there. And he said, now this is what we're... And I think a lot of people get caught in that moment where that's the only bit they hear. You've got cancer. And as they go through everything else that they're showing you and telling you about what they need to do and what we're probably going to be doing, all you've heard is, I've got cancer. You've got cancer. And I think that's where Lisa stopped. And I was listening to him, what he was saying. I was like, okay. So now we have to deal with it. And then we came out of that room, and I was of the kind of thing, right, okay, next step, what do we do to stop this? And Lisa was just, I can't believe he said that like that. And I can't, and because she didn't expect it, neither of us expected that. I think she was thrown a lot more, because she actually said, "Are you okay for driving home?" And I was like, "Yeah, well, I haven't taken my legs off. I'm fine." Yeah. So then we drove home, bought the lamb, got the lamb dinner. So that was good. So, and that was it. So it's, yeah, the feeling on that day was just numb. And then going home and having to phone up, and it was my mum's 80th birthday, and there was going to be a party on the Saturday, and we phoned up and they said, well, we're going to cancel. I said, no, don't do that. And then we drove up to Leicester, where a lot of my family are, and sort of spoke to them and saw them. But yeah, on the day it was just quite numb, I suppose. But then thinking, right, I've got this news. What do I do with it? Do I let it take me, or do I go, right, okay, so we got this, where do we go? Let's sort this.
So what was the reaction of your family and friends?
It's still the same now, is that they seem more concerned than me. They're more worried than me. And as through the last bit, with my father-in-law, he'd had prostate cancer, and I think his reading had been 11 or 7 or something like that. And because it was 11 years before me, he had it. So I never remember if it was 11. That was, you know, his PSA. But his PSA was much smaller. And they're all very, very good. And then when I went through the process and I had my operation and radiotherapy, it wasn't until after that I found out that he thought, this isn't good, that, I wouldn't survive. So on the face of it, they've got, they want to be supportive, but there's a worry. And some of them cannot hide the worry as much. Like I say, my stepdaughter, I suppose is the best way. She was so lovely. She and I sort of, it's if we ever hug, it's once a year. She's not a hugger. And she came in, and like I say, when she came in, I heard her at the front door, and because she knew I was in, when I said, "Is that you?" she didn't say anything, because she didn't know for the first time how to approach me, how to say it. One hug, got one hug then. Okay. A couple of weeks later, she came in and she said, "I know this is silly, but," and I can see it now, it's still up on the wall, there's a plaque thing that says, "Everything is going to be okay." And she goes, "I bought this. I don't know if it's," I said, "No, it's lovely." Because people don't know how to approach you. And for me, that's why calling it Carmen, I know sometimes it goes Carmel, Carmen, sort of, she's changed her name a couple of times there, but mainly Carmen, because she's shaking her maracas. That's why I use that, because it is easier on people. When I say to them, they say, "Oh, if you've got, how are you doing?" I say, "Oh, I've got Carmen." They go, "What?" I say, "Oh, it's my word for cancer," and blah, blah, blah. And then when you chat about it, then it just takes a little bit of the edge off it. So how people have been reacting, they've been lovely. They all want to help. They all want to do something. They all, I know, feel impotent, because they cannot do anything other than be there. And that's the bit I feel sorry for. I feel sorry that my illness causes them that angst, that sort of like, I want to do something, but I can't. What can I can just be there. And you go, that's all you need to. That is all somebody needs to do, is to make you know that they're there. Okay. Unfortunately, during this, you do find out the people who are really there and those who aren't. Okay. And there are people that I thought might be there for me that haven't been. Surprising. But again, it might be because they've got issues with it. Yeah.
I can feel it when you talk about that. Those people are not there. I was actually going to say that some people handle that news by steering clear, because they don't know what to do. They don't know. It's not the fact that they want to avoid you. It's the fact that they feel useless, helpless, and full of anxiety. And also the thing is, why should people get close to you if they think they're going to lose you? So so it's no different for, I say no different, the similarities are with mental illness and this whether or not you're going to lose someone through cancer. The similarity is because people are very reluctant to get close to someone if they think they're going to lose them. And it's the same as people have suicidal ideation, then thoughts, and it's known by the people around them. The people around them don't necessarily want to get close to them or hear their news anymore because they're worried about losing them, so that they detach. But it's not the fact that they want to, it's that's the way they deal and cope with shutting off pain. That's how I can see that.
And also, Kerry, on that is that I've got probably my best friend, and he's literally stood by me. I mean, at one stage when I was teaching Taekwondo, I started having a bit of a breakdown in the fact I thought, I can't do this. I've been doing it for years, and suddenly I was getting up in the morning, I was like that. I wanted to just hide under the duvet, and I had to go and teach Taekwondo. And I had to be this instructor that knew what. And I said to him, I can't do that. Can you come along in case I go to pieces and you run the class? And he literally stood by me. He came and stood by me, never said a thing, stood by me there, and then at the end said, nothing. Nobody knows the difference. What's going inside isn't coming out. Now, when Mr. Sanger, my instructor, was passing away, and we were getting towards the end, and I was seeing him as much as I could. I was driving over to see him, and I said to my mate, look, you haven't done this. And he said, well, it's difficult. And I had I said, you saying it's difficult? Of course it's difficult for everyone, time and whatever and that. He said, no, it's difficult for me. And then I realized he'd lost both his parents and his sister to cancer. And he said, and then he said to me, I don't want to go there and break down in front of him. And he sees that, or it doesn't help him. And I realized, everybody has their way of dealing with it, and everybody has their thing, that he was actually being protective of my instructor because he didn't want to go there and give him anything negative. And I felt really bad that I felt about my friend. And I realized, and it made me really start thinking about, okay, if somebody, like you say, if somebody shies away, there's a reason. There's a reason. And it's not necessarily a negative reason. It's because that, they have their way of dealing it and they don't want to affect you. So again, trying to be really open to other people and not thinking inside your own box. Well, if they're not contacting me, they must be bad. No, they're not contacting you. It might be for a different reason. Okay, so
the thing is I'm sorry. I'm okay. Unapologetic on a real scale. When I hear that, I actually want to say I'm sorry. Don't wait till things are too late. If people are listening to your story, those that know Mick, you know what he's going through. You're hearing his story, and I'm going to personally say that. Don't wait till it's too late where you can't say something. If you don't know what to say, hi and crack a joke. Because what Mick is looking for, what I would suggest that is even doing this, what you're doing now, a sense of purpose. So he takes the focus off of some of that pain that you're going through, but it gives the purpose in delivering the message. What you're doing is delivering a message that is going to make difference to people's lives. And even with what we're saying here, where people shy away and friends shy away, I'd hope that people take something out of this. Cool. And it doesn't. It's with every situation. Cool. While you have an opportunity, say something. Just send a text or whatever you've got to do for starters. That's an icebreaker. But know that people can't necessarily respond back to texts because it's difficult and it's easy to ignore. When you pick up the phone and you talk to someone, they don't really have the option, do they? But hello, now you've got their voice. You see, talk. And I think that's in an everyday situation. So thanks, Mick. Was it worse wondering if you had prostate cancer or when you knew you had it?
The mind's a wonderful thing and it plays tricks. And so wondering whether I had it, and I think the thing was when I knew I had it but didn't know how bad it was. And that's the thing, because I stay off Google as much as possible. I don't Google too much about the next step or whatever, because there are so many things on there there are a lot of medical things on there from America which may not be pertinent here, because in America you have to pay for your treatments. And when I'm on Facebook, I speak to people all over the world, and in America, in the main, it's frightening that you don't just get the best treatment, you get the treatment that your insurance can pay for. So I've had no problems because I'm in London. I've got Tooting St George's linked with the Marsden, the best hospital. Marsden is the best for cancer care. So I'm very lucky that I'm straight in with that. So the wondering whether I had it is that thing of, you don't know, you start looking at, well, if I have, how bad is it going to be? And so you go from, you don't even know, but you've already sort of gone too far down the line. And I think that's the thing, is trying not to look too far ahead and look at too many of the symptoms, because that's where I think it affected me. But certainly the worst part of my journey was the 2 weeks from being told, yes, you've got it. Then I had to have an MRI and a CT scan. And as my stepdaughter will tell you, I prefer a CT to an MRI. It's just because the MRI is in a tube, this machine that's quite noisy. Well, it's not the hula hoop, because the hula hoop is the CT where you go through it. It's like a big polo mint, the CT. I prefer that because you go in and then you come out, so you're not enclosed. If you're claustrophobic, the MRI can be a little bit enclosing. So once you had those, then they have a meeting, and then you get told the result, and they say, right, this is what we found, and this is going to be the treatment. Mm-hmm. Those 2 weeks of not knowing was when I found it hardest. And that's when I phoned the doctor and said, look, I'm actually struggling with this. I need some help. I said, my strength is not quite there. And he said, there's a couple of things we can do. You can get your counselling. He said, but you won't get counselling for 6 weeks, by which time you've gone on for treatment. Or we can put you on antidepressants. And he said, it's not, he said, don't worry. He said, it'll help. So when I phoned him up, and this is the first doctor that said, when I said to him, oh, do you know what my situation is? He said, yes. He said, I'm sorry to hear it, Mr. Snelders. He said, but he said, well, maybe we can do it. Let's put you on this. And that was the time, and I was in Lidl's, and I was going to ask him, because he said, I cannot tell you the results I've got the scans and stuff in front. I cannot tell you the results because that has to be told you by the consultant. And I said, okay. He said, where are you at the moment? And I said, well, I'm in Lidl's. He said, would you really want to hear it in the middle of Lidl's anyway? I thought, well, what would you do if he says, you're fine? You go, yeah, great, and buy broken biscuits and stuff for everyone. Or if you told, no, I'm sorry, but the result's really bad. What am I going to do? Sort of curl up in one of the freezers with the, frozen chicken and just go to sleep. So it wouldn't be the best place to do it anyway. But that not knowing of how bad it was probably the worst bit.
Wow. What treatment did you have, and what was available, and did you have a choice in treatment?
Right. I wasn't given a choice because of how it was. There are a number of treatments, and again, I'm not a medical expert, but there are a number of things now, depending on your level of the prostate cancer. They can just treat it with radiotherapy. And you've got different ways of doing it. They can do things where they put these little seeds in your prostate, so that the radiotherapy goes right to those bits, rather than it being an overall radiotherapy like on your pelvis and it's hitting everything there. They can do it so it goes to there. There are all sorts of things. Again, you can look it up on Prostate Cancer UK, but there are things like radiotherapy. I'm not sure if chemo comes in at any point without removal, so there might be chemotherapy. The removal of the prostate, and that was what I thought. If I got cancer in the prostate, take it out. I wasn't given a choice. They said they were going to take it out because they found that when they took the biopsy of 12 clot phases, they found that it was in 11. It was full in 11 of the 12. And that's when the doctor said, it's more or less 100%. And I said, no, 11 out of 12, that's only 92%. So again, you're sort of, I'm going to take that 8%. Go, yeah, okay, there's 8% that's not. There's a positive. So they said we're going to take it out. The amazing things they can do now is, if that's the prostate and they take around it, the nerves that help you with an erection are clamped onto that prostate. What they can do is, depending on what surgery, they can peel those nerves off, take the prostate out, and you still have those nerve endings. They couldn't do that for me. They had to take all the nerves out. But this is what they can do. And of course, a lot of men are worried about after effects. Will I have erectile dysfunction? So am I going to be a man? That kind of thing. So the fact that they can do this is available for people. So the treatment I had was, they removed the prostate, and then about a month and a half later, they started on radiotherapy, because once they've taken the prostate out, they'll take it off to histology. They will look at it under a microscope and find out how bad. And then they say, because what they did with me is, normally they might cut a margin like that, just a little area like that. But what they did was they cut a bigger one around it because of how bad it was. And they knew it had been escaping the prostate. So they look at that area to see if there's still, and that area still had some cancer. So they didn't know whether it had gone into the rest of me. So they took that out, and then they say, right, what we'll do is they'll do salvage radiation. So what they do is they go to the area, zap it with radiotherapy to try and kill off anything else that's there. Okay, to make sure that. And so that was the process that I went through.
I'm going through my list of questions here, and but it brought me into another question though.
Yeah.
It's a question after the question. So off that question, radiotherapy, does it make you feel tired? Because my mum went through radiotherapy, but it doesn't mean I understood it. So she didn't really speak to me in depth about what cancer was feeling. And I think, as a person that loves their loved one, we're not informed enough. I'm sorry. I think that we do that research in there because we want to lighten the load from our parents in telling us, so they don't have to talk about it and just get on with what they've got to get on with. But unfortunately, I wish I'd have just had that conversation and known a little bit more. But they're at the same stage that I'm at, because although, like yourself, although you're the one that's going for the treatment, the news and the schedule's at exactly the same stage. What's next, Mum? What's next?
Yeah.
So that anxiety through all of that is so overwhelming. So, for yourself, what treatment's available? You didn't have a choice. They did the operation. What were you feeling on that day when they done that operation?
That was an odd one, because again, I built myself up to, right, we're going to do it. And the way I mentally went about it was, it's from my Taekwondo background, I'm a small bloke, and when I was a colour belt and I would be sparring, the guys, even in the lightweight, I was giving away about 2 stone. I stood no chance. Okay, I wasn't particularly good anyway, but I'd give it a go. And I used to say to my instructor, I get up there, I'm like this, and I'm really nervous, thinking, why am I here? Why? And he said, good. I said, what do you mean good? He said, that's adrenaline. He said, adrenaline's, and we're animals, and adrenaline goes through us to prepare. It puts the blood to the parts of the body that need it to fight. And he said, when you start looking at it and saying the nerves are a good thing, he said, you change your approach. And so my approach to the day was, we're getting rid of it now. Today's the day that starts off the rest of my life where I'm without this cancer.
Mm-hmm.
So I've managed, this is where I would hope that these little things help other people to think, right, I can turn it around. I can get some fortitude from it. I can approach it from a different angle, so that it's easier to cope with from the anxiety point of view. Mm-hmm. And so on the day, Lisa came along with me. We were there, and and I was thinking, right, okay, and I was saying to her, and, you know, sort of, I'm all right. I had to ask her every so often, say, how was I on that day? I felt like I was being quite strong. She'd go, yeah. Yeah, what do you mean, yeah? It's, you know, she said, yes. She said, I know how you handle things. So she won't ask me certain questions because I'm handling it my way, but she can see if there's, you know, a dent in my armor. She's good like that, but she doesn't probe it because she knows that might then push me another way. So when I went in, I was on mind, this is the day we get rid of it. I know that all the way through, I kept saying to them, they say, you know, sort of, they told me what they were going to do and how they're going to, you know, sort of, we do this, then you're going to go, this machine's going to do this. And I know afterwards when they came, the anaesthetist and the surgeon came out and said, oh, well done, well done. I think, well done. All I had to do was lie there. I said, did I help tie the knot or something? No, I was just, you know, I don't know. I put it in your hands. So I just had that strong belief that, right, this is an improvement. This operation, I'm not scared of the operation because these people do loads of these, and I'm fit and I'm healthy. So I have a better chance of coming out through surgery. So I'm going to go in there, and this thing is being removed from my body. And then we've got the rest of my life. So that's how I was sort of coping with it then. I mean, Lisa said she had to laugh at me because even as I came out of the anaesthetic, I was still away with the fairies, but I still managed to sort of try. She said, I was being pushed on the trolley, and I can remember just coming to, and the nurse said, look who's here. And Lisa was there, and I said, oh, hello, darling. You know, sort of, how are you doing? But apparently, because the trolley was going and she was going right, and I was going, hello, darling, how are you doing? Because I was trying to focus. And she said, this is an absolutely appalling attempt at being fine, just coming out of surgery, just coming out of anaesthetic, my eyes rolling in my head. But everything was like, yeah, let's go forward. Let's go forward. So that was it.
Oh. How long did you spend in the hospital?
I was very lucky, just overnight, and I'm glad it was overnight. Hospitals are not the best place to get well, just because you're not in your own home environment. So the less time you can spend in hospital, the better. I've since had, a few years ago, I had a hip replacement, and I had to spend a little bit more time in hospital there. And you suddenly realise the more time you spend in there and you want to get home and stuff, and there's that anxiety that. So luckily with this surgery, they take it out, then you're taken to a ward. They do try and get you up and walking, not straight away, but, you know, so a little while after. All they're doing is checking that everything's gone okay with the surgery. So they're checking that that you've got a catheter in. They put a catheter, and I suddenly realised, what's this? Strapped here. Oh God, I've got a pipe coming out of me. I remember one of the nurses coming and said, "Oh, that's good." She said, "Rose." I was like, "What?" She said, "Oh, that's what we do." She said, "You know, because at first you've got blood coming out, so it's dark red, so it's like red wine. Then it goes to rosé, and then it goes to white wine because it's." I said, "Oh, right, it's a rosé." So, well, if you give me a rum and coke, I'll be happier. But so they're checking those things. They're checking that, you know, sort of, they check things to make sure everything's all right. You stay in overnight, and if you're okay, you can go out the next day. And I had two guys in the ward who were nice guys, but they actually had a huge argument, and the nurses couldn't stop their argument, and I had to try and stop it from my bed. And at that point, I phoned up Lisa and I said, I am going to be well by lunchtime. Get here, get me out. And luckily, I was allowed to go out at lunchtime. So I was lucky. It was just overnight and the next day. So I think, and a lot of them are like that with the robotic surgery.
Wow. So can I just get this right? When we talk about, I know that you're explaining the prostrate. I think for me, a lot of women or some people will think, is it your testicles? And I'm going to say that.
Yeah,
right.
No.
Right. The reason why I say it is because that is an image that can be planted in our head, that when you talk the word prostrate, women would think it's testicles. So when you paint the picture of going into hospital, having an operation, we expect that you're walking like this, you see? And that's And I think, I'm not saying I think maybe anyone at the end of the day maybe not so sure about what actually where this prostrate is, what this prostrate is, what it means. And we and checking and these things like that. And the other, can a woman find a man's prostrate? You know what I mean? Vice versa. So I think for me, so it's not your testicles. It's it's a gland somewhere else.
Yeah,
right.
I mean, this is where when they say the DRE, the digital rectal examination, and yes, anyone can find it. It's not like a party game like pin the tail on a donkey that you want to do, but you can get that thing. So, you know, sort of, and it's that thing that sort of, you know, a finger going at the backside, and then you can find it from there. I mean, I did say at one of the talks, when I was at this talk with loads and loads of builders at this building site, and all these guys were also and then I said the DRE. I wouldn't have that. I said, listen, come on, guys. I said, look, let's have a show of hands. I said, how many of you have had a finger up the backside? And a few of them put their hands up. I said, right, now put it down if it was your girlfriend. Let's just go for doctors now. Let's not have the, you know. So, but anyone can find that prostate if they want to. Again, it's not my favourite pastime, but yeah, it is something. So it's inside, it's internal. So it's not very easy. It's, you know, like checking your breasts or checking your testicles to see if there's anything there. It's not as easy to access. And again, it's one of those things men are quite uncomfortable about.
It's that's to me, I think I actually really didn't know the difference. I'm sitting here and I'm being honest, because I am an honest person, to turn around and tell you that I actually really didn't know the detail. You hear the word, you see the word. I'm actually researching on what prostrate is. Yeah, you're telling me, but I still think, is it something to do with your testicles? You've just confirmed to me and the whole world that it isn't your testicles. So what did I gain out of that? Pure education right now, just here and now. Thank you for confirming that. It lightens the load of more understanding for me, because I literally did think it was part of your testicles.
Yeah.
So
well, there's 2 out of 3 adults, 2 out of 3 people do not know where the prostate is.
That's right.
And that's a medical fact. That's one of the facts that comes from Prostate Cancer UK, because, like I say, we don't know every single organ of our body and what it does. And so that's because it's not something that goes wrong very often, and certainly not as much in younger men. Although, you know, this is it. Although the average age is 50, you do get people who are a lot younger. But in the main, it's men over 50. So because you don't think about it until you're at that age, a lot of people don't even think about it because they don't even know about it.
But I'm just going to reiterate what Errol said the other day, that from as young as 30 years old, if you're BAME, more likely to go and get tested as much as you can, especially if it's running in the camp.
The thing is that at the age of 50, you can demand, or 45 you're in the Black Afro-Caribbean, you can demand a test. If you're 30 or 40 and you go to your doctor and say, I want a PSA test, they will ask you a little bit more about your background. So if you say, many of my family members have had prostate cancer and some of the females have had breast cancer, it will increase your risk. So they may, but they do not have to. They only have to if you're at the age of 50 or above, or 45 if you're the Black Afro-Caribbean.
Great. Thank you. How did you cope with the recovery period?
That's the recovery period was, I spent it with my uncle and aunt for the first week, because Lisa was still she's a teacher, so she was still going to school. And I was saying to her, you know, you don't need to be away from that. And so my uncle and aunt said I could stay with them. And the first couple of days, I came out of hospital, and I've got Lisa's family immediately round. My family are, like I say, most of them are up in Leicester, my sister in Oxford. So when people came down, you know, they come down. And I remember on the Sunday, and I'd fallen asleep on the sofa. And when I woke up, I think it was Lisa's sister, who's a nurse, Kyla, and she was sitting there, and she brought little things like honey and things, and she was just sitting there because both me and Lisa had fallen asleep on the sofa. So she'd been let in, and she was just sitting there waiting for us to wake up. And she said, "Hello, just wanted to see how." So it was lovely that I had that support, and I wasn't feeling too bad. And then because of the anaesthetic, it can make you constipated. And again, for the first couple of days, just being careful what you eat. Sort of don't get home and go, right, I'm going to have a big red meat feast. It sort of bungs you up. Because on the Monday, I'd been feeling okay, and on the Monday, I had a bowel movement, and it was like the whole of my energy dropped out of me, and I felt rotten. And when my uncle came to pick me up to take me, he said, "God, you look awful." I said, "Thank you very much." And I got in the car, got round, and my aunt, bless her, really lovely. She came out with this glass of green gunge. And she said, "Yeah, I've been looking at it, and spinach and cucumber and beetroot and banana, and it's in this smoothie." I said, "I just want to go to bed." And I realised she was doing her best for me. So, but I went to bed, and it took me a couple of days from there. And then you've still got, because when they do the prostatectomy, I had the keyhole surgery, where it's a big machine and it's like a machine gun thing, because you've got six things like, so like so across there. So, and they had little staples in from there. So that's a little bit, obviously it's gone through muscle and stuff, so it takes time for that. But again, the healthier you are, the fitter you are. I'm not saying I was super fit but because of my martial arts, I was a little bit more than somebody possibly my age at 51, I hope. My big instructors would probably say, "Yeah, we've seen you work." No, but because of that, I think things knitted together better. The usual thing with any operation, they say, 4 to 6 weeks before you can drive. So, sort of that. But having the catheter in, because you had to have that catheter in for a week.
Oh, really?
Because what they've done is because, like I say, the prostate is around the urethra, so you've got a tube like that, and then this clamped around it. So in order to take that out, they have to cut, and then they sew that urethra back. What they do is they have the catheter tube in there to make sure it stays expanded, so that as the stitches are sewing together, knitting together, that it doesn't close up. So that tube is keeping it open. So it has to be there for a week. So it's a very weird sensation, having this catheter in, and then sort of you don't go for a pee because it just comes out into a bag from there. So
actually, because I used to be a carer, so I know about the catheters and stuff. But
yeah.
That was always a scary issue for me when I had operations, when I was going to come out with a catheter or not. So how does that actually feel, having that in you? Because we don't know. So especially for anyone, really. So how does that feel?
Well, the thing is, because luckily for me, it was put in while I was out.
Yeah.
I know when I was at the hospital, and I'll go through this, and I hope it doesn't offend anyone that are listening to this. But the thing was that my catheter tube was bright blue. So when I looked down, there's suddenly this bright blue tube. I was thinking, why did it have to be such different? And it was suggested that it was because it was a different colour from my own penis, so they could make sure that if they cut it or anything, they know which bit's which. And so with this, when I was in the hospital, there was a guy who came in after me, and he wasn't prostate cancer or anything. He just came in, this Asian guy, and he was in this bed opposite me. And during the night, he was in a lot of pain. And he had been catheterized. The catheter had been taken out, but then he couldn't pee, and they had to put the catheter in while he was awake. And he was howling away. And I said, don't worry, as long as they put a blue one in, otherwise they might mix them up. Don't worry. So I wasn't very helpful. But yeah, so I was lucky that it didn't feel anything because it was put in while I was asleep.
Yeah.
And then it's coming out, and all you're aware of is it's on this bag on your leg. And then at night, there's a bigger plastic one, which you put on the side of the bed. So from there, but it did take it did take. The first time with Lisa was at my uncle's, and she'd come every night after work, have something to eat and that, and then she'd go home. And we said, we'll leave it till later in the week for you to stay here with me because it might be uncomfortable with me in the bed and turning and stuff. And then I was going to have a shower, and nobody had said to me that the tube is detachable from the bag or from the box. So of course I'm going around with this. So I went to go and have a shower, and I said, right, how do we do this? And I said, right, you hold the bag, and so this tube is coming out. She's outside the shower holding this, and it wasn't until the second shower that went, hang on, I can just take the tube off. It doesn't matter. But then, yeah, and then she because my mind goes off onto stupid things, and I was in the shower and I just started giggling, and she went, what now? I said, look at this, and I was going like this, so this big blue tube's going around. I said, can you imagine if it was like that? Yes, but so it didn't feel, the actual feel of it wasn't it got a bit uncomfortable towards the end. And if it gets a bit dry in there, you got that. I think having it removed was possibly, I was a bit concerned, but of course when they pulled it out, you don't have the control. And this is one of the things about doing exercise, Kegel exercise, etc. You don't have the control. And the lasting thing from that is I have what's called stress incontinence. I'm not incontinent in the same way that I know other people have been. Some other people have been really bad with incontinence after these. But again, if you know that this is going to happen, you start doing your Kegel exercise, which is sort of like pelvic floor type exercises for blokes. You do those before to strengthen those muscles so that you will have that strength to afterwards. So when I'm doing Taekwondo, I have to be very careful what I do. And if I get too excited and start jumping around, you suddenly think, hang on, there might be a puddle. Let's just stop. Let's slow down there. But it's only a little bit. I'm very, very lucky. But that's from there.
So then the quick question I want to pull on, just one question, I'm getting diverted, then I'm going to talk to you about the Taekwondo. One of the questions, going to the catheter, my question, I've always wanted to ask the question, so I'm going to ask you because you're here. We're talking about the catheter. You've explained that part of it. Does your body still have the urge to want to get up and go to the toilet, or is it just something that just happens and you just can have that laying and not have to get up?
You get used to the fact that, because at first you think, I'm going to feel that urge.
Yeah.
But you don't, and you don't realise that you're going.
Okay.
And that's the weird thing, is because you think your body naturally would tell you, I've had this much drink, time to go to the loo. But you don't get that urge. And I was always surprised in the morning when I picked up the bag that was on the side of the bed. I thought, I drank a lot last night, didn't I? But of course it's great because you can lie there. Whereas now, sort of it's a pain in the backside, because sometimes I go, get up in the middle of the night and go for it. So, would have been so easy to have the catheter back in again, wouldn't it? But it's a very odd feeling at first. At first you think you should feel the urge. And then when you realise you don't, and then you go, okay, because it's draining out all the time. It's draining out. So that's, yeah. So.
Yeah. Thank you. Someone just said, Adrian Ashby just said, great information with humour. So thank you. I mean, it makes it light and slow, and it's nice to know that someone's listening, so it's good. So how did focusing on Taekwondo, what is that? Is it that?
It's exactly that. That's exactly how it's done, Kerry.
Is it?
No. Taekwondo is a Korean martial art. It's mainly legs. It's mainly kicks. It's yes. You got good flexibility. You should come to, right. You're coming to one of my classes. Yeah, tooting and clapping. It's a martial art, and the martial art. What differentiates, I think, a martial art from just fighting, and careful what I say, because every martial art form, kickboxing, etc., have their own things. like I say, I never say, I wouldn't say Taekwondo is better than this, is better than that. It's your experience of it. So I had very good instructors, good people around me, very encouraging with the people I was at. And I know other people who've been to Taekwondo classes that they thought were useless.
So it's not because I used to do karate, but I've never done Taekwondo.
Right. So again, different places. Karate means art of the open hand. So it's very mainly punches. Yeah. Okay. Taekwondo, the Korean form, Taekwondo, art of hand and foot, based on Taekyon, an ancient kick form where it's mainly legs. I wonder if any of my students are watching going, right, well, put me back out. But so the thing is with any of those is it's not just a physical art. It pushes you to be the best you can physically and mentally. And the thing for me was always the fact that with sport, I loved sports. And when I was at school, as now, I'm small. So I want to get into the sports teams, but most of them were based on size, based on speed, now speed, fine for my height and that, but if I haven't got that length of leg for the, so as people are running, I've got to do 50 paces compared to someone else's 20. So I'd love football, but I was always super sub. I was always on the subs bench. We'll put you on in a minute. And if we were losing heavily, I'll give them a game. And then I go on, like a little terrier. So Taekwondo was something where it didn't matter about my size. It was about achievement. And it was also about how I wanted to attain that achievement and my mindset, how I was going to set my mind to say, I have this goal and I will achieve it. I might not be the most gifted. It might take me longer, but I'm going to achieve that goal. And so those kind of things were the things that sort of helped me.
We've gone way over time, right?
I was going to say, well, why don't we continue on that, and then we can come back
But people can play this back in their own time. It's always going to be uploaded to YouTube as well, so they can play it back in their own time. Right now, this is our time, and it's about message and the cat.
And the cat, it's the cat always. You just can't. She's like this. My Taekwondo lessons, or my students see her, they love it.
Pets are therapeutic, aren't they? So was that the end of the medical assistance, or was there more?
So in terms of assistance, there's afterwards there for me, because of the like say all the nerves have been taken, so there's a whole load of things for the erectile dysfunction. So they did say to me when I started, move that near the cat. They did say to me when I started that I went into the doctors and he said, look, due to the severity of your operation, he said, you're always going to need assisted erections. I said, well, that's good because it's no fun on your own. And he was, yeah, they always looked at me sort of like, why are you, well, you're always going to need assisted ones. Yes, yeah. So, and so he went through it and he said, what we do first of all is we're going to try you out on things, and depending on what you have, we can change it. And you don't even have to use just one, you can use more. So the first thing was a pump, and it's this pump, and you pump in order to draw the blood into it, and then it's basically an elastic band at the bottom, so it keeps it like that. And
that's what they used to do in the nightclubs. They used to make sure that, well, they used to use a pump and then they tie an elastic band in to impress the girls at the end. Sorry, so that's what they did. So that's where I was related to what you're saying. So go on.
Is that what they used to do? Like, I don't know what nightclubs you
We used to have a stripograms.
Oh, right.
Male stripograms. They would sort themselves, and then they would put a band in, a band round, and so it gave that length.
Yeah, and keeps the blood in. Yeah. So they do that, and and again, sometimes it works, sometimes it doesn't. And the other thing is that it's we're saying, that thing where they used to say with condoms, they'd say, sort of use it as part of your, lovemaking, use it as part, you think like, what? It's not the sexiest thing, sort of. And the same with the pump, make it, well, what do you mean? How do you make it part of your what? Roll a dice, 6, 1, 2, 3, 4, 5, 6. What happens if it's an odd number? Do you deflate it? What, sort of, it's like, what's that mousetrap where you go to, you go, hey, cock up. So,
I'm
you're
still
right. Yeah. So there was the pump. They give me what's called Cialis, and Cialis is a tablet, very much like Viagra, but it's a slow release over a couple of days. So all it is to keep a blood flow going, not to keep you erect, but to keep a blood flow going. So then when you do use the pump, then it will help. So they have those. They have what I call my eye drop, which is there's a thing called alprostadil, which there's two ways of putting this. There's an injection that you can put into the penis, or there's a drop. So you sort of put it down the end, drop it down the end, and then wait there for 30 seconds. And then after about 15 minutes, it works and it opens up the cells so the blood flow goes into it. So you have all these things: eye drop, injection, this, that, and if all else fails, because some guys, sort of, again, you don't have to use just one at a time. So like I say, the Cialis every day, the pump. You can even do the injection and pump a little bit more, so there's ways of doing it. They're not instant. This is where I think part of problems can be, because you can't have that spontaneity. You can't have that instant sort of, you get a bit frisky. You can get a bit frisky and you go, hang on for 20 minutes, hold that thought, read a book, have a glass of wine. I'll be back in a minute. It makes that bit difficult.
You must have gone through a wealth of emotions with that situation, but even though you're going through it, your partner at the end of the day is going to be worried about what you're thinking going through that process, and you're going to be worried about what she's thinking going through that process, and so sometimes you have to come together and think, okay, how can we make this fun, but work on it. And I mean, that's what I've taken from your videos, that you it got really quite exploratory in the end, didn't it? You quite the pair of you, aren't you? You had it more than I ever had it. Yeah, so you was practicing quite frequently, and that's more than a lot of people get.
That's the thing is,
aren't you?
Yeah. So it's that thing of you. Again, it depends on who you're with.
Yeah. How
they're reacting to it as well. And knowing, and again, it's I think one of the main things is knowing that somebody would prefer to have you there.
Yeah.
And if this is the price you pay to stay alive, okay, it's still a bonus or a boner.
It is a bonus, and it really defines love, doesn't it? It does. It really does. The strength of love, when you can actually, if you take out the intimacy part of that, then you can actually strengthen what I find defines love, really. Going through those mountains together, and the explanation and the communication on the emotions of how things feel, I think that makes the process much more interesting and more easier. Deal with.
I think with any partnership, you find if both of you are on a high, it's great. You're both on a high and it's a wonderful time. If one of you's on a low and the other one's on a high, you can support the other person. How do you cope with it when both of you are on a low? If you can get through that, that's the bit.
You're incredible, aren't you? Right, you had two stories about radiotherapy. Number one, and number two, the family.
Right. Okay. Yeah. So this is where I am very lucky. Throughout this whole process, I've had a strength of mind that has allowed me to cope with it. I have had a sense of humour that has definitely been helpful, and my family as well. Sort of both Lisa's side and my side. Their comments, their quips, their same sense of humour as me has always helped. So, sort of even in the darkest times, we can say a little joke and it just lightens it. Even to lighten it for a moment, it's always good. When I was having radiotherapy, so radiotherapy, you go in every day. Radiotherapy for me wasn't a big thing. I was reading on a prostate cancer page the other day, a guy who was saying, really awful, really bad effect from radiotherapy. And I couldn't fathom out, because he didn't really explain it, I couldn't fathom out what was the effect he was talking about. For me, fatigue. And I think a lot of people go through that fatigue. The actual process of radiotherapy is there's no pain. Again, I'm talking from my experience and from what I know in general. You go in, the first day you go in, you're on a machine, and they, first of all, they tattoo you. So they pinpoint. So every time you go in, they just put you down. They've measured you up, set it so your measurements are all down. So when you come in, they set up the bed, you sit on it, they lie on it, and then these radioactive beams will go exactly on those spots. So they do these little tattoos. So after I had these little,
are they proper tattoos?
They're tiny, the tiniest dot you can get, but they are real tattoos. So I've got one on one at each hip and just one above the pubis. So from there, and so these beams go into you, and it takes about 15-20 minutes, and then you go home. One of the hardest things for the prostate cancer people is that when you do it, in order to elevate the area, you have to have a full bladder. So the timing of when you're drinking, so you go in with a full bladder, they do the radiotherapy, and then when you get out, you go to the loo, and it's like, so it's great. But when I was there, I used to go in, first of all, I asked them if I could go in the morning, because I thought, right, if I go in the morning, I can go home, have a rest, and be ready for Taekwondo in the evening. So I was doing that, and I was going in, I had I think it was a 9 o'clock appointment, a 9:30 appointment. And there was a guy who had a 9 o'clock appointment. He was driving all the way up from Kent to the Marsden in Sutton. The Marsden in Sutton is a 20-minute drive for me. For him, it was an hour and a half to 2 hours to get there each day. And when they were coming up, they would bring their daughters with them. The first few times they'd bring their daughters, 2 little girls with them, and they'd be there because they couldn't drop them at school and then come up. And he came up a couple of times, and because he had such a long journey, he couldn't control himself, and so had to go for a pee, which meant he then had to wait longer. So I was chatting to him one day, and I said, well, sort of, how could, that be better? He said, well, if we could come in just a bit later. I said, well, like 9:30 at my slot. He said, that would make such a difference. We could girls at school, we could get up here. And I said, well, let's talk to them, let's ask them. I said, I don't mind changing. And so we changed those, made it so much easier for him, because it didn't affect me. Like I say, I was lucky. I was 20 minutes away and could have this. And I kept in contact with him for a little bit afterwards, not massively. In the end, it's sort of our contact faded, and I don't know what's happened with him. But, seeing his situation from that, so there was that. And then where I started thinking about doing talks on prostate cancer came from another guy. When I completed my radiotherapy, on the last day, I took in some little cakes and little bottles of champagne to give to the staff, because I'm in there for, it was 12 weeks. I can't remember how many weeks. It's a long time. It was 45, so it's, it's 30. It's so many appointments, times of going in. So at the end of it, I took him these things, say, thank you very much. Thank you for looking after me. And I did say to him, I gave him, and the guy said, I don't think we can take the alcohol. I said, all right, I'll take it away with me. And as I went up the corridor, he'd come running after me. He said, we can. I've just found out we can. I dragged it out of my hand. And as he was doing that, he said, can I just ask? He said, how you did it? How did you manage that? I said, manage what? And he said, how did you manage? He said, because every day you came in, he said, you were quite upbeat. He said, and you were friendly and talked to us and that. He said, and you just didn't seem fazed. I said, well, how else am I going to do it? What, I know that, what if I shouted at you, if I was angry? He said, well, some people get frustrated and stuff. He said, but we had a guy who came in, this is what I was saying, a guy he'd had prostate cancer, but it was very, very mild, wasn't on the same scale as mine. Mine, again, isn't on the scale of other people's. I'm not saying, so mine was still a very manageable, even though aggressive, it was manageable. But he said, when this guy was told he had cancer, his life fell apart. When he was told he could be cured, he couldn't handle that because he'd already given himself this death sentence. So I said, well, maybe give him my number. I said, he's in for a few weeks, I'm finished, so, but give him my number. Tell him if he wants to talk to me, you do that. And he didn't. Now, I don't know whether they gave him the number. I don't know if he just chose not to call me. But I always wondered what I would have said and what I could have done. How you could have helped him. Is there something I could have done? And that's when I started looking at Prostate Cancer UK and came across there, because I actually approached them to say, look, I create videos, I do editing videos, filming them and stuff. You know, is there something I could do for you? And they said, well, we want volunteers to go and do talks. And then I started doing that.
Yeah, awareness. And this is we are today. Yeah. Awareness. Brilliant. Right. So, yeah. The man who found it mentally difficult. So that's the point of that message, how difficult it is, that it does affect people's mental health. That's why we're giving you awareness today. Right. We have 3 more questions. The after effects of surgery and how it takes its toll physically and mentally. And I think you've kind of explained a lot throughout that about how draining it was. And if it wasn't for Lisa, you know, Lisa was just your rock there. So you're going to go into a little bit more detail.
Yeah. So the physical things, like we say, the getting over it. My parents they're elderly. My dad's passed now, but my parents were elderly at the time, and I don't think my mum really knew what was going on that much. She said nobody really told me. I just don't think she really took it in. So she didn't actually come down to see me until November. I had the operation in August. She came down in November. My dad, because he no longer drove, his wife brought him down, and that was in late September or mid-September, so 6-7 weeks afterwards. So they didn't come down. And when they came down, I think they were surprised because they said because that was my first time I was going back to the hospital to have a chat with the oncologist. And so when they came down, they were quite surprised because I said, well, I'll drive, because I was already back in the car and I was driving. So the physical thing of going back, the first time I went back to Taekwondo was a week after the operation. I didn't do anything. I had the catheter on my leg underneath my Taekwondo suit, and it was the mayor of London had come and was talking to us. Was come because one of my Taekwondo students was working in his offices, so he came to see this club that had been going, because Taekwondo in Tooting, this club has been going for, it'll be 40 years in 2 years' time. It's been there a long time. Mr. Sanger was there for teaching for 30 years. I took over in 2010. So he'd come down for that. And so my friend who had stood beside me, he was running the class, and I came in and I went to Taekwondo then. And my uncle had driven me there. And then I sat down for a bit at the back and I just watched, and I said to people, right, okay, no, look at that. Now that stance, wider, longer, do this, do that. And one of my other friends who was running it, he said, why don't you go home? He said, look, he said, you know, just go home. You're tired. Go home. I said, I'll go home when I want to. He said, this is my club. My club. I'll choose when I go home. I'm not going to be stupid, but I'll go home. So they were all they were obviously concerned for me in that. But it was a boost. It was a real boost. And knowing that I was going to be going back there. So I think having that goal. So when you go through it, rather than saying, what now? Say, right, okay, when I come out of this, if you are going to go into something like this, say, right, okay, this is going to be a process that's going to make me better. So if I'm going to be better, what am I going to do with that? So what do I want to do when I come out of this? What am I going to, even if you say, I'm going to go on holiday, I'm going to fly, after COVID, obviously, but, you know, in 2052, I'm going on holiday. They'll say, I'm going to go on holiday. I'm going to do something. Plan something with your new life, with your new found health. And I think that was one of the things, knowing that I was going to be able to get back to Taekwondo. And Taekwondo for me, I do it several nights a week. I do it for hours on a night, where some people say, so you're standing for 4 hours a night and you don't have a break. And that I said, and I still don't think I have enough time. it's a passion for me. It's not a job, it's a passion. I love it. I love the students that come through it. I love the people that I'm around. I have that immediate gratification of seeing when something clicks. Somebody's been practicing something for ages and it clicks, and you see the progress. A lot of the kids, the progress I see is immediate, and it's wonderful to see. The confidence building stuff. So for me, that was a really important part. If I can get back to that, so have that goal. So physically, that helped a lot. Then with the things with, again, saying, okay, they've taken these nerve endings, so the physical side of lovemaking might be affected. We say there is still a way around it. So there are still ways to find it and find that. So again, just going through those. So physically from there, and again, mentally, the taekwondo helped. That planning ahead, because you're saying at this point, I've now got the rest of my life. Because with that first diagnosis and them saying go on holiday, and then finding out if I'd gone on that holiday, I wouldn't be here today. I wouldn't have been here for the last 7 years. I've had 7 years since then. I've done a lot with those 7 years, and I've loved it. And so that's when people say it's gravy on top, that's what it is. This is all gravy for me. Yeah. So whatever happens, if it ended tomorrow, I've had 7 years extended where I've done things, and there have been other people. I've seen Lisa's, we've got a grandson. I mean, her nephews and nieces, my nephews and nieces, and their children. I see them. So all these things I would have missed out on. So it's been a positive. So always saying, right, I'm going to plan ahead. It's a future that you can fill with what you want. Good or bad, you can fill it, but you've got a future to fill.
Absolutely. These are your questions. What can be done to counter or cope with physical effects of stress, incontinence, erectile dysfunction?
Right, okay, dysfunction. Yeah. So the coping with the stresses of it, coping with the physical things that go on as well. Again, having the people around you, being able to talk. I mean, one of the messages that comes out throughout all of these things that you cover on your stream, it's about talking, it's about communicating, even having pets. I talk to the cat all the time, don't I, Toots? So being able to talk about it, being open about it, knowing that anything you're going through, which is for you, because what we do is we tend to not talk to people about it because we're afraid we might look weak. And it sort of when it takes the strength away from you, so you don't want to talk about it. And then you realize when you do talk to people about it, they don't see you as weak and they want to help. And some people will be better at helping than others. But you get a range, and it helps you to not focus. You focus so much on yourself or something, and somebody can open you out and say, well, have you thought about it this way? Or can you, sort of, so I think coping with the stresses of it, I mean, they say physical exercise is good. It is good to be able to do that. That thing of trying to get yourself out of doing, of focusing on it. It can be very difficult. I've just had a couple of difficult days, and it will go up and down. And it's like I've got a friend, George, and he had this is where I also get strength from him, because he was literally at death's door. I went to the hospital, and I remember when his wife was told he may not have long. This was back in 2008. He is flourishing now still. And I was at the hospital when he was told, when he took his first steps after chemotherapy. He had some heavy chemotherapy, and he was on the edge whether he was going to make it or not. And so it shows me that there is so much that they can do. And I think people, the stress of it, that people start thinking is, okay, this is it. And, but there's such a huge medicine cabinet within the NHS that we can all dip into. We don't have to pay for it, which is a wonderful, wonderful thing we've got in this country. We've got this wonderful NHS which will treat us. and they've got a big range of things, and they can start with one and go into another and that. So there's that. So knowing that there is the support there, a great support network of counsellors, etc., that you can find either through the NHS privately. There's things from there, but search for the help. Don't be frightened to look for the help. I think people think they have to deal with things on their own. You don't, and that problem shared and halved is true.
Problem solved.
Yeah, physically, again, the effects of this, we've just gone through that there are so many things they can do for the erectile dysfunction. So you've got a lot of physical things there. The exercising, and like I say, allow your body to heal as well. So after any of these things, you'd have to have time for yourself. I know when I had my hip operation, I had a hip replacement 4 years ago, and Lisa had to go to work, and when she came home, she said, "Have you had a restful day?" I've been at my uncle's for a week, and I come back the first day, and she said, "What did you do today?" I said, "Well, I got some washing from upstairs. I've done 2 lots of washing. I've cleaned the kitchen. I went up to Lidl's and I did some shopping. A shop that would normally take me 20 minutes to walk there, get the stuff and come back, took me an hour and a half." And she said when she went into work and they said, "How's Mick?" She said, "I'm living with bloody Superman." But the thing is that, so again, physically sort of like doing it, but a couple of days later, I was paying the price for it. So again, you have to say, take what the medical people are saying, allow your body to do the healing. Don't go too fast. Don't go too quickly with it. But then also make sure that you do the exercise, etc. they give you.
Thank you. Did the frustration of failed attempts cause you and Lisa problems, and how do you resolve it?
Failed attempts. We're talking about the sex bit, I think now.
Right. Did the frustration of failed attempts cause you and Lisa problems? Hey, your question.
Yeah. So failed attempts, yes. Yeah, I mean, you do find that because, again, the spontaneity is not there. So it builds up and it builds up into something. And like you say, you might get the worry. Is it going to happen? Is it going to happen? And it is frustrating when it doesn't. You have to have somebody who's understanding. But also you got to say, again, it's that thing of that intimacy, sex isn't just about one person, but it doesn't have to be about both of you every time. You can please your partner, and that in itself is pleasurable. It doesn't have to be that sort of, right, you've orgasmed, I must orgasm. It doesn't have to be that. So again, it's finding so when you're with someone, so anyone you're with, the intimacy of that, how that intimacy is going to be, what it means, how it feels, because sometimes it feels good just to give. And that's one thing I think that, can be a problem, because you think, oh, well, you didn't seem to get much pleasure out of it. So, well, just because you don't get to the ultimate end, as it were, doesn't mean that it hasn't been pleasurable. So I think that's you have to understand those things and go, yes, and also accept. It'll be like any time you have sex with a partner. Sometimes it's going to be much better than others. It's not always going to be top shelf. This is brilliant for 30, 40 years. What's that?
I said it's not like the movies, not always. I used to say,
exactly. Yeah.
Put me like that on the TV. They make it look so easy.
Oh yeah.
Imagination.
That's the thing. So I think from there it's just, again, accepting that, sort of, it's like good days and bad days. Sometimes we have good days. Yesterday I was a bit concerned about doing this because I had a bit of a rough day yesterday, and I started thinking, oh, I hope I'm not like that tomorrow. What am I going to be like tomorrow if I'm like that? Today's another day. Today's much different. I am quite buzzing today. So it's just different. It's just different. And that will be the same with anything. Yeah.
Yeah. As your partner, do you know how Lisa felt? And what would you say was the key to your mental health survival? And where are you now?
Right. So in terms of how Lisa felt. Like I said at the very beginning, Lisa's a very strong woman. I mean, mentally and physically, we used to call her Ant Woman, because whenever we were helping people moving houses, she'd be, how can you lift all that? Oh, she'd just be doing things, and she'll be on a mission. I think she's probably, out of her sisters and brother, she's the kind of one who doesn't waver, doesn't show the emotions that much. It wasn't until I found out, she actually told me, and it wasn't until much later. We found out I'd got cancer. We were going through things, a CT scan, MRI, all those things. With the radiotherapy, she said, sort of, I'll come with you. I said, look, it's nothing much. Don't worry about it. She said, no, I'll be there. So the first couple of sessions, she came with me. When she realised what it was, and I said, I don't need a mental support. I don't need, fine. I said, because it takes you out from school, out your work. But what happened was, she went down to see her sister, and her sister lives down the A3, and she got in the car, she went down the A3, and she said, I was in floods of tears. It just suddenly, she said, as I was driving, crying. So I got to my sister's. She said, she opened the door. She said, I don't know what's happening. And her sister was quite surprised. She came in, had a good old cry. They had a good laugh about the fact that she was crying, but she needed that outlet. So I think she's very much a little bit of a kind of pressure cooker, in that she will keep it in and that, but it does affect her, and then it'll come out, and then she can deal with it again. She has her way of coping with it. And so that's from there. So yeah. Where are we now?
So more to your life. I mean, this is just snippets, to be honest. You crammed in so much information into this broadcast, and for me, I'm glad it's going to sit here. Somebody's going to tune into it. Like we said, we could go to down the bottom, speak to Errol McKellar, MBE. He's happy to give you some advice around it. You can contact Prostate Cancer UK, which I'll make sure the numbers are there. Mick, any questions that you have for Mick, please do send them to me, and I'll get them over to Mick to answer any of those questions, if you'll be happy to do that. And Mick, there is another side to you, Mick, and I know that right now that you're still in the process of going through all appointments again, and dealing with this issue again still, and it is difficult even for me to sit here and interview you and think and not have an emotional attachment to this story. I have an emotional attachment to this story because I know that time is all I've got, and I've just seized an opportunity to meet somebody that's raising awareness, has the same aims as me, and that is to prevent fatalities in every single way. So I'm quite privileged to interview you, but I'm just Kerry, just the same as you're, Mick, and we have a history, don't we? And the message that we're putting out there is immense, really, and I don't know what to say, to be honest, and you've helped me with questions. And that's one of the things that, on a final note, one of the things that the support to understanding is to pose those right questions as well, and to get the right message out. Now, this wasn't about what shall I ask Mick. Mick has his own way of delivering a message, and he needed you to know the finer details and bits and bobs, what comes with it, rather than just questions I perhaps wouldn't have asked. I might not have asked those questions. So the way that you've depicted this and delivered this in stages, thank you, because we have covered a lot, and we just ask people to share this message. Mick, you're coming back again and tell us about your naughty bits. Not but the naughty bits, because I'd like to hear, if I'm aware of exhaustion, I'm aware of what you're going through, but what I can actually say is, Mick, if there's something else you would like to tell the world and tell the population, here's my platform, please just bring it on and let's do this. So it's up to you. You come back again and tell us another. There are so many avenues to you. You are a man, but you have a history, and I'd like to know about your history. to where you've got to here, rather than all doom and gloom. Let's celebrate your life. That's what I want to be doing. Who is Mick Snelders? I want that to be, who is he? Who was he? You know, who was, you know, vice versa. Same for me. I would like to leave in that imprint. What did this man or this woman or these people do for the community? How recognizable is it for anyone that's sitting here watching this today, how much you've put your life on the line here, and a bit of Lisa's, to be honest, and a bit of your friends and family, and expressed within that family unit exactly what you went through. And that's only a snippet. There's so much more to this. So I'm, you know where I am. I'm going to say
I'm happy if people write in there's questions and stuff, and there's things that want to be spoken about, you know, I'm more than happy. I'm more than happy. Again, for me, it's been a really important part of this to get the message out so that people know about it, understand a bit about it, and not be quite so frightened by being told you have this. And like I say, the word cancer, when people say you've got a cancer, not for it to be immediately sort of the doom and gloom, go, right, okay, so we've got this, what can be done about it? But if you're armed with it, with the knowledge how to stop it in the first place, or how to stop it at a very early stage, all the better. So anything I can do to help with that, I'm happy to talk about. So yes, if you get questions, if people write in and say anything to you and you say, Mick, we've got a load of questions people want to ask, I'll come back, but that's fine. But thank you once again, Kerry, for setting all this up. Yeah.
No, thank you, because I mean, it's people like yourself saying these stories. I mean, I didn't want the Mom Project to be about a one-trick pony, and I think at the end of the day, with what Mind Over Matter stands for, exactly what you do within coping with cancer, you put a mind to the matter and you cope with it in a humorous way. So please do visit that channel to really find out the details. They are in stages, so it's actually easy when you look at your videos. They are in stages, and that process of what you went through is depicted so much more in the comfort of your own home. Just press play. They're not long, they're short snippets of stages, and it was incredible. I spent most of the afternoon watching your lives, watching your YouTube channels, and I've subscribed to your YouTube channel as well, so I could push out later throughout the months, throughout the coming years. And in my time anyway, you know, the way I look at it is, because we don't know how much time we've got. You might carrying Carmel around with you, trying to boot that little bitch out of the system, excuse me, and I'm still trying to boot out COVID out of the system as well, you know what I mean? So look, they're both bloody C's, and they're so they should both end in T's, but there you go. So for me, thank you, Mick, so much. Thank you guys for your patience in this interview. And for me, I really wasn't really monitoring the time, to be honest, because I know that I scheduled it in for a time, and I know that it's your time, but you could have said, Kerry, I've got to go. But the message was so important. Thank you for raising awareness, how to cope, how Mick coped with cancer and copes with, dealing with that Carmel or Carmen. And I wish them to get stuffed and go to hell, to be honest. And because I'd like to spend more time with you. And I think that's the thing, you know, I can't imagine what Lisa's feeling like, but I can. She's your wife, and so you will do that. And it's about the comfortable factor of both of you, you know, and all your family. And I do have the upper hand of experiencing what it is like to lose people with cancer and going through the process of cancer and learning all about these things and seeing the little bugger on the screen as well. So it's an eye-opener for me. So it makes the knowledge that I'm gaining from everybody makes the process, and you're absolutely key spot on with that. It makes it so much easier and tolerable to hear what's going on, how to cope. Thanks, Mick.
Okay.
Thank you.
See you soon. Okay.
Please share the awareness. What do you think of people that don't share this message before we go?
It just denies somebody else the chance to to get that message, to know about it. If they haven't got that information, it could be too late. I've done loads of these talks where I've had people commenting afterwards, 2 people here, 3 people there, 4, different places where people have said because of the talk, they've gone and got checked, found out they've had early stage, and it's been treatable. So by not sharing the message, it might deny somebody that chance. That's all.
You heard him. Thank you. That's my
Okay.
share. Hold your best smile there, love.
See ya. Bye.